Welcome everybody to Adult Services Scrutiny panel today. Perhaps we'll get everybody to introduce themselves in the room so that people online will know who's here. We start at Susan Jones, Chair.
My name is Councillor Michael Locke and I represent Scrutiny.
Yes, Alan Jeffrey, Councillor Uplands Ward.
Representing Scrutiny as well.
John Franklin, local coordination manager. Lee Campbell, principal officer, Campbell Property.
Sorry everybody, the mics weren't switched on. Right, yes please.
Right, this time, my name is Michael. Well, my name is Councillor Michael Locke and I represent Scrutiny Ward.
Yes, afternoon, Alan Jeffrey, yes, Uplands Ward.
Cheryl Philpott, Scrutiny Ward.
John Franklin, local area coordination manager.
Lee Campbell, Principal Officer, Tackling Poverty Service.
Amy Hawkins, Head of Adult Services and Tackling Poverty.
Councillor Louise Gibbard, Cabinet Member, Care Services.
Lucy Friday, Principal Officer for Transformation in Adult Services.
Helen St John, Head of Integrated Community Services for Swansea Council and the Health Board.
Lisa Phillips, Project Manager for Transformation Adult Services.
And just welcoming Dave Howe, Director of Social Services. Thank you, Dave. Okay, item number 1, apologies.
Chair, we've received apology from Tony Beto.
Are there any other apologies? Okay. Item 2, discloses of personal and prejudice and interest. Are there any? If so, Liz will hand out the form to be filled in. Chris, God, why isn't the hand coming there? Chris, Councillor Chris Holly.
My daughter works for social services.
Thank you, Chris. Any others? Item 3, prohibition of whipped votes and declaration of party whips. Anyone want to raise anything? Right. Minutes of the previous meeting, item 4, minutes of the 12th of December. Go to page 1. Page 2. Page 3. We've then got the letters on page 4, 5, 6. Got 7, 8, 9, or what will be on that? Yes. So I have those as a true record. Take your silence as agreeing. Yeah, okay. Item 5, public questions. Times is, are there any? No, we're going through this very quickly. Item 6. Welcome. I think it's Lucy Friday's going to, oh no, Louise, sorry.
Yeah.
Sorry.
Great, is it?
Yes,
Make that. Thank you very much. Really grateful to have the opportunity to bring our progress report today on our Adult Services Transformation Programme. Grateful to Helen, Amy, Lucy and Lisa for writing the report and for assisting with questions and things today, hopefully. As previously reported, the programme focuses on the 3 main themes of prevention and early help, enabling and promoting independence and demand management. This is all about, as it suggests, promoting independence, reducing the need for higher level intervention from our services and ultimately better outcomes for individuals and families. Sorry.
Thank you, Louise.
We are at quite, sorry, I'm just waiting because I can hear. That's okay, it's just quite distracting. We're at quite an early stage of rescoping our early help and prevention work. The aim is to have a better understanding across the service and in the wider community of what good practice we are already doing and what is being done by partners, particularly in the third sector. And this work is also to explore how we can better work with people earlier and step up or indeed step down support when needed. The report shows we're already making really good progress within this area with our access and information assistance in the common assessment points who can link people in at the front door with services such as assistive technology, third sector organisations, particularly working with SCVS, our local area coordinators, who you'll hear more about later, and so on. Another important area in early help and prevention is home first, and that all important discharge from hospital with the right support in place to promote longer term independence. In terms of the second theme, enabling and promoting independence, this is looking at that next tier of support, working with the health board particularly to reduce stays in hospital or avoiding people from going in the first place, and then that reablement on discharge. We can very much see how this is helpful, not just in terms of better independence for individuals, but in the cost avoidance for the local authority, with an average of £46,322 per month saved thanks to installation of things like the Just Checking system. Other assistive technology is coming on board with the new Smart Suite being launched, and the digital switchover for Lifeline customers is continuing. Finally, the third theme is demand management, and this is all about the right support at the right time, effective use of resources, reflecting on the needs of our community and ensuring that we're maximising our capacity in domiciliary care. Our 4 care homes have been carefully planned to provide long-term care for people with complex needs or dementia, for respite and for step up from the community. We also have step down capacity with 8 beds at Tywynarloedd for resettlement for people with complex dementia, 24 beds at Bonamine House, and as we've reported before, all have excellent outcomes. Our externally commissioned domiciliary care contracts have been refreshed, and we're confident that we're helping provide stability and quality, stability for the sector and of course for individuals and their families. There's a lot more detail there on how we've changed how we look at some of these contracts, but I will highlight that it's really important that we've worked alongside Co-Production Network Wales to make sure that the service users, carers have all been really involved in this process. Finally, we're currently undergoing a reorganisation of our assessment and care management teams. I won't comment too much on that because it is currently at staff consultation stage, isn't it? But it's very much about improving that experience when people come to us through the front door and how we move them through the support needed. So happy to hand over to officers to jump in with anything important that I might have missed, or open for questions.
Thank you, Louise.
Thank you, Louise. Yeah, I think that was a very comprehensive summary of the report, actually, far better than I could have summarised it. Yeah, I suppose, as Louise said, our focus is in this area. I suppose the only bit I'll touch on is going into the next year and beyond. We will continue with these 3 main themes. I'm sure that everyone can understand why that would be our area of focus. You know, we will be exploring all elements and picking out particular projects and programmes of work underneath those themes again. The early help work is a particular area of focus for us. We understand the benefits and we understand the need to actually do something very different in our services. So all of our work that we've continued with this year will continue into next and probably beyond as well. So yeah, that's kind of a summary for the next steps.
Thank you, Lucy, and welcome, because I don't think you've been here before.
No, I haven't.
And your colleague has come as well.
Thank you. Thank you.
Welcome. Right. Amy, do you want to add anything?
No, nothing to add, but we're happy to take questions.
Okie dokie. Viv, how do you want to add anything? Right, open it for questions. Anybody got questions?
It was very comprehensive, Chair.
It was, wasn't it? Alan, you've got a question.
Yeah, I think I might have asked this before, just to refresh myself on the term care in the care homes. I mean, dementia, I would have thought would be some specialist sort of training, I would think. I mean, are these trained nurses or are they just trained carers? And how do we define the difference between the two?
Yeah, So our internal residential homes are only residential care homes. So if people have nursing needs, their needs are more complex. If there are assessors having nursing needs, and we would support the individual to go into a nursing provision that has that medical support. But in terms of our teams around the residential care, yeah, they deal with really complex care needs for the individuals, non-medical needs. Sorry, saying that they do support with medication, but but they're supporting care, and they are trained. So they're trained in dementia care, they're trained in behaviour support, they're trained in a whole suite of support. So there's ongoing continual professional development for the teams to support them in their work. Do you want to?
Yeah, I think one of the things that we've learnt we talked about Westfield House a lot last time when we were here, but one of the things that we've learnt really is one of the key planks really to supporting best outcomes for people with dementia is perhaps demedicalising the model a little bit, and it's very much around the environment that we're looking after people in. Fresh from seeing a video about some of the successes in T Westfield this morning, and looking very much at the way in which we support people. But I think in T Westfield as well, we've also got close links with health board staff we're not able to provide nursing care per se, but to be able to support the care staff to work to the top of their licence really around managing people's complex needs so that they can remain in that one environment and we can get the best outcomes for them. So it's very much, excuse me, sorry, a collaborative approach.
Thank you, Lola. Councillor Jeff
Thank you.
Jones.
Yeah, thanks, Chair. Yeah, a few things. Interesting report. With this early help, how it actually mentions collaborative working. How were you getting everybody to actually work together to coordinate who needs this early help? What sort of communication channels do you actually use? Are they, I assume there were existing ones, but are there any new channels actually being opened or new ways of working?
Thank you. Yeah, it's a really obviously a very good question. In fact, that's part of our focus actually for this work for this year, is to explore and understand better what we already have out there and available to us, and making sure that we maximise our opportunities wherever we can. So in terms of communication channels, there's been a lot of I suppose re-educating our internal staff, also ourselves, and understanding and making sure that our partners understand as well what else is out there. Making the connection, though, is the really tricky bit for us. We've got social work teams who are in process and systems which direct a certain train or direction of travel. So what we've looked at is how we can support through revising our system of operations to actually put these intervention points in, where there is a pause and there's an opportunity to actually challenge and look at alternative options for delivery. So we've seen that already in the benefits of it through certain contact points, like our common access point is the obvious one with our access and information assistance. And then beyond that, so at every stage we're promoting and we're trying to embed a system which prompts all of our teams, not just social work, to think about alternative and other solutions to offer the greatest round of support for the individual and tailored to their specific needs. So as part of the proposals that are with staff at the moment, we're looking at expanding our review function within social work, with a real focus on understanding how that could be a pivotal point in that person's journey or person's conversation to actually explore alternative means of support. But yeah, it's about bringing all of that together. So understanding what we've got out there, making sure that's understood and we're utilising it as best we can, but also building a system which enables people to easily access it. So that's really the key challenge that we have, and that's the big piece of work we've got going forward. But yes, that's a bit of a summary.
Okay, Jeff.
Yeah, okay. So yeah, a couple of other questions as well. You mentioned common access point. I can remember when it was first introduced on, shall we say, some of the perhaps problems they had and so on. It seems to have become a lot more, if I can call it, professional. People perhaps have been there quite some time and built up some expertise and so on. I think Louise actually mentioned a figure, £46,000 or something. I don't know if I've mixed that up. No, sorry. Page 13. In the last 9 months, this has resulted in 28% of inquiries into common access point being signposted or closed at the point of contact. you know, what was the figure before? You know, is it improved, or is it 28% on what it was before?
Apologies, yeah, that's a good point. Yes, it is an improvement. Obviously, I should have put in a scale to demonstrate that improvement, but yes, reaching an average over the last 9 months, I think, is quoted of 28% is the peak at which we've hit. So that is the highest level that we've achieved and sustained over the last 12 months, 9 months.
Okay, and one other point as well, assisted technology, again, you know, that seems to have evolved from the, I can't remember what it's called, but you know, the lanyard around somebody's neck and so on. It actually mentions there, you know, just checking. So what exactly is that? Is that something new, or, you know, what is that process?
We've had Just Checking in operation for quite some time, but we've had it at quite a small scale and we haven't really promoted it as well as we could have, I think, in the past. So over the last 12 months, with availability of additional temporary resource into the team, we've been able to really push it as an option. Basically, it's a series of monitors that can go into someone's home for a period of a couple of weeks. Normally, we put them in situ in person's home, and it can monitor that person's movement throughout the day when people, friends, family, carers aren't there to observe, and it can help inform an assessment. So really, that's where the benefit is. And the biggest area, I think, where we've seen the benefit and where the cost of avoidance figures mostly come from is where we've managed to delay, perhaps, but avoid someone's entering into residential care. So it's really useful for us when we're working with individuals and their families. It's also hopefully a bit of reassurance to families and carers as well about the activity of their loved ones when they're not around, and it offers some reassurance. And it's just proved to be such a helpful tool, really, to just get that overall picture and a much better understanding of that individual in their own home environment. So that's a very quick summary of the purpose and benefit.
Thank you, Lucy. Okay, Councillor Jones? No, nothing coming back? He's on mute. You're on mute.
Sorry, there's a couple of other things, but I'll just read my notes again. I'll come back later, perhaps.
You do. Councillor Philpott.
Just a little question about because the care homes, residential care homes that we have are now perhaps dealing with more complex cases. So the question is a little bit around the people who are being maintained in their own homes. And I understand what Lucy said about the AI, and I think that is going to be really good. But what about the carers and particularly perhaps our domiciliary care team who will be going into those homes? If some of these patients or individuals they need extra care, they might be more challenging. How do we help our domiciliary care staff deal with that? And that's our staff. And how would we know that a private company had the expertise to be able to deal? Sorry.
If I can respond in terms of the internal service first, Councillor. We've had quite a lot of feedback. You're quite right in what you described, and particularly in our long-term domiciliary care service, we get a lot of feedback from the staff around the sort of challenges they are facing. And you're quite right, a lot of it is around cognition and behaviour and the sort of behaviours that they're meeting when they go in to try and look after and provide care to people. There's a couple of things that we're doing around that. We are taking we're refocusing the service so that we've got greater support from the wider community. So around our therapists and around some of our other professional staff to be able to support the care staff with triaging and having multidisciplinary board rounds for the caseload that we've got in-house. We've found that to be very helpful in terms of managing more complex behaviours, but also in terms of people whose behaviour becomes less complex as they progress in their journey, particularly with dementia as well. So one of the things that we have identified from that with the in-house service is the need for further training. And we are currently, I think we've done a couple of rafts of training around management of complex behaviours to support the staff with de-escalating behaviour, and then also making sure that you know, sometimes when we go to see people, they might not want care right then. And it's an opportunity, you know, we can't necessarily come back in an hour, etc. So we are supporting the staff in terms of the wider team around them, and also in terms of specific training around managing the sort of challenges that they're finding in the community. But your point is absolutely right around it is a different cohort of people that we're supporting to keep at home with more complex needs now. That's just from in terms of the in-house home care service.
That's good to hear that you've recognised it. So if you had somebody who, one of our care workers was, because what I have a concern about is if people aren't equipped, if they don't have the knowledge to be able to do their job, they can become overwhelmed very quickly, which then means that they can become ill, they go sick, which then compounds all the situation all the way through. So if they had a case where they were becoming overwhelmed, what would you do? Would you then do a review straight away? Or I'm just looking at the management of that what I'm thinking is quite critical at that point.
In terms of, again, I can only speak for in-house. I'm sure Amy will speak a bit more about external providers, but we've got the staff have regular supervision. They have regular supervision with their senior colleagues who obviously link in with the managers as well. So where we've got, I guess, because we take this sort of board round approach to the people that are on the caseload, we kind of know the individuals where it can get quite intense, it can get quite complex. So we do try, it's a balance between making sure that we've got the best consistency of care we can to individuals and making sure that those staff that are providing that consistency don't get overwhelmed by that. So the staff are encouraged in team meetings and in one-to-one sessions to have that communication. We will rotate staff out of calls if it's becoming too intense for staff. But again, part of what we are trying to support is consistency of care. But we do take it very seriously in terms of our one-to-ones, in terms of our supervision with staff, and in terms of feedback from teams as well. So we do try to keep consistency whilst not getting staff overwhelmed and exhausted by some of our more challenging individuals that we are looking after.
Can I just say some words about external providers? So we've got a number of commission providers, and as a part of that, we do have checks and monitoring in terms of the quality standards that they do, but also they're all registered services as well. So they're registered via the Care Inspectorate Wales, inspect them as well and ensure those quality standards are there. So that includes things like staff training is maintained and up to date, and the relevant processes are in place for when the staff need to escalate things, when they need support, just in terms of their continued professional development as well. So it's all covered through that contract monitoring, our assessment and checking of that we do, and also via Care Inspectorate Wales.
Thank you, Amy. Any other question?
Yeah.
I've got a question, if it's okay. Where do the GPs, and I know the prevention that the LACs actually do. I know we're having a presentation now next, but they are very important for the prevention of people actually deteriorating then, for want of a word. Where do the GPs fit in doing this?
I suppose the GPs have got, you know, they've got a professional line to ring through to the common access point, and they do refer through to us. I think, where the GPs fit in with this? They're certainly aware of the LACs. I'm sure they're aware, and that we've got the sort of the acute clinical team. So we've got a network really of the acute clinical team will feed in. They will refer to the GPs for people who they're worried about at home. Do you mean the sort of the earlier help stuff?
Well, to highlight if somebody is beginning to struggle within the community, you know, and there was a case in Gowerton not that long ago where a 100-year-old lady was not known to social services. Well, the GP would have known that she was beginning not to be able to cope, maybe. And I just wondered if there was a role for GPs within this process.
I would have thought yes, there is. I'm not I'm not quite sure where the link.
Yeah, I think some GP clusters are better than
Better than
others,
others, yeah.
on this, isn't there? I think
Maybe,
I think
maybe.
we know that some of them link in very strongly, and some of them even have their own sort of local area coordinators. I think the local cluster is. Am I right? Have I just made that up?
They've got social prescribers.
Social prescribers, I think, which is similar. Yeah.
Is there a
but-
communication system between the LACs and the GPs?
Yeah, I'll come in. Sorry, I did. Yeah, I passed to Helen as well because of the GP question. But I think if you're asking wider as well about how people just find out generally about early help, prevention offers, or prevention, sorry, I should say first, and then
And
early help.
highlighting people in the community.
Yeah, absolutely. So we have a whole network of colleagues that support with this. Area coordination is definitely key, and you'll hear in the next presentation about the impact of the work there. We've also got other colleagues working out in the communities and that we directly commission, whether that's via our third sector partnerships, carers, centres, others who might be identifying people who aren't coming to us via traditional sort of through the common access point that we've mentioned already. So, and the work that Lucy described about sort of bringing it together is a lot about this communication as well. So I think we always know we can improve on this, but it's people come to us from many different ways and are aware of us, and we do outreach as well to be aware of people. So when we you know, come across individuals, it's about that early help and prevention support. So definitely area coordination is a part of it, as is, yeah, SCVS, our flexible support team. People might come to us through a short period of reablement and then find that we link in with them. You know, there's lots, yeah, many different doors to social services, I suppose.
Thank you. Thank you. Councillor Tribe, you have a question?
I have, thanks, Sue. And I thought that question about the GP and his role, impressive question, and it needed to be asked in order to keep them in the loop. But my question would be: is there any kind of reliance on agency staff in the carer's role? And if so, what kind of percentage do they make up? Just the agencies of the total workforce? Thank you.
Internally, no, we don't. We don't use agency staff. We tend to rely on staff to do overtime to cover gaps and to cover sickness, but we don't internally use agency staff in dom care, in
Right.
domiciliary care.
Okay,
That's fine. I think that's a way forward. Thank you.
lovely, thank you. Councillor Jeff Jones, you've got another question.
Yeah, actually, on that point, I can see on page 16. Oh God, screen's just gone blank. We're actually retendering, you know, a different specification and so on. You know, in essence, I think, you know, we're asking the external providers to perhaps do more. Do you think that'll actually impact on the cost of the contract?
I'm sorry, I'm just checking I'm on the same page. Yeah, we are. Yes, we've got a number of different pilot approaches that we've done at the moment in terms of dom care, which I think we've reported to you before, but particularly in our areas where we've traditionally found it quite challenging to get the runs of dom care covered, whether that was because of rurality or just because of I don't know, a number of factors. Sometimes it could be a more urban area to get the coverage. So we've tried different approaches of different contracting approaches. So that's what we're having to retender now, is to make sure that we're compliant in terms of procurement requirements and financial requirements. And looking at that, will it be more expensive? It's an interesting question. I don't know that I can answer that directly. You know, we'll have to see through the tendering process, and I'm not sure that we're expecting people to do more. I think this is about bringing it in line with just to ensure we're compliant really with the processes. But we've done a lot of work with the providers. We've had a big provider network this week actually in terms of bringing everyone together and talking about the different approaches.
Thank you, Amy.
Okay. Yeah.
Okay,
Okay.
are there
Thanks.
any-
Yeah. Yes. Thanks for that, and hopefully it's not going to cost us any more. And you know, they will work with us anyway. But on the point of you know, people want to live independently, and you know, we want people really to perhaps look after themselves a little bit more, and carers and so on. And I'm sure, you know, more and more people are, you know, living independently. But have we come across any downsides of this?
We're all just looking at each other. Yes, it is a
I
good
was
question.
just thinking, it's, people live independently and so
Yeah.
on, they can do more for themselves and so on. I was just, thinking, one of the perhaps minuses, people get extremely lonely.
Yeah,
And perhaps
yeah.
there's less
It's
contact and so on.
it's a very personal thing, really, isn't it? Everybody's going to have some people, it's they want to be in their own home, and that's the only thing that matters to them, really, isn't it? And
Yeah,
that then other people perhaps would thrive in a more of a setting, community sort of setting of being in a residential home. But I think if we're going, if we're kind of, really pushing the early help, the prevention side of it, it's making sure we're linking people with opportunities in their communities, so that they might be living independently, but not lonely. That's not a word. Not in a lonely way, if that makes sense. So it's a very individualized approach. If I answered that accurately, do you think?
Yeah.
I
Thanks,
think
Louise.
Councillor communication is going to be really important, and communication channels.
Right, before I bring you in, Paxton, Dave Howe has something to add, yes?
Yeah, no, just coming on that last point, I think that's right to always be challenging. Hang on a minute, what might the unintended consequences or opportunities be? I don't think there's a downside, particularly in terms of in enabling people to be as well and able as possible. Then what individuals will potentially want is different opportunities around how they can live well, and that come back to probably a challenge to all of us around and society generally around, well, how do we remodel some of our housing and accommodation based solutions? What's the best way of supporting communal living for older people? Is it the current way our housing stock has developed over time, or is it something different? That doesn't argue against the approach around whatever those sorts of solutions for individuals might be. You would still want people to be as well and able as possible, which is mostly what we're trying to push forward. If we do the work badly, that would have negative consequences, but clearly we're not advocating we do the work badly and leave people without appropriate care and support and they haven't been re-abled or enabled. That's clearly not our approach. But I think it probably is a wider challenge around for society beyond council. Council can contribute to that around how generally do we support an aging population? How do we support aging well? What might those future housing and accommodation based solutions might be? Lots of which go beyond what we're describing here, but I think what we're describing fits with that sort of vision. But that wider vision for society, government, the council, we perhaps haven't articulated that well enough overall. And clearly in a climate currently of shrinking public services funding, it's difficult to see how you would envisage that, but we shouldn't lose sight of it. Definitely, that this only really works if we're looking at that wider context as well. So another great question.
Thank you, Dave. Councillor Paxton Hood-Williams.
Hi, Chairman. Well, we're talking about this whole area of domiciliary care, and particularly when we're looking in terms of the rural areas. Just wondering what progress we're making or seeing, in fact, in the establishment of micro-organisations to provide this in local areas, particularly, as I say, in the rural areas, and particularly making use of direct payments in that respect.
Yeah, good question again. No, I mean, it really is. Sorry, this touches a number of our work, actually. That's why we were just looking at each other. So the numbers of people having direct payments is up. I think with the breakdown of how many more are using those for micro enterprises, I don't have those figures to hand, sorry, but I'm sure we're due to regularly give you an update on that as we do at this committee in terms of direct payments. The support of micro enterprises has been a focus in the last couple of years. It's been, or few years. We've particularly where we know there are again more challenging to cover kind of areas, whether that's again because of communities, because of or just opportunities for individuals who might want to provide services. So we do know that yeah, direct payments are up. There are more micro enterprises. We promote it via SCVS. They've got some development work that they do supporting micro enterprise development and social enterprise development. And also they've got a directory as well that our teams regularly use as well. So there is, you know, good work's happened in these areas. I don't have the stats to hand, sorry.
Thank you, Amy. Okay, Paxton?
Just to say then, we are seeing increased coverage in the rural areas in this respect, then, is it? That's the summation.
Yeah, yeah, definitely. And I think what we're seeing as well in
Okay.
dom care, we've got very few people, not very few people, the waiting list is manageable at the moment in terms of those waiting for care. And we are seeing it's a really even spread across the county, you know, in terms of areas. There aren't any pockets now. So it really is just a case of managing that demand.
Thank you, Amy.
That's
Thank you.
good to
Are there
hear.
any-
Thank you.
Good. Are there any more questions before I move on? Thank you all for your contribution. That was really interesting. We go on to item number 7 now. And who's leading on this? Do I get Hayley to introduce first of all? All right, Hayley.
Yes, thank you, Chair. Yeah, it's a pleasure to be back with you again to consider and explore the impact of local area coordination and what that looks like in our communities right across Swansea. It doesn't feel that long ago since we first came with the first impact report last year. And, you know, we have reached full coverage across the county during this year. The presentation, which Lee and John will take you through, contains qualitative data and quantitative data gathered from individual local area coordinators, individuals being supported, stakeholders like community groups, for example, and elected members. And I think it's fair to say that it is having an enormous benefit to our city and to our residents. They're making a real impact and difference to the lives of our residents and helping to build community resilience and making people feel more connected to their communities, which I think was touched on earlier. And I'll just hand you over to Lee and John to take you through the presentation, if I may.
Thank you, Hayley.
Okay, thank you, Councillor Gilliam. Chair,
Okay.
I'm just going to
Lovely.
share my screen if I can.
Yeah.
I'm hoping this will work. I'm in the meeting, so right, has that worked right? Yeah. Fab. Yeah, thank you, Chair. So just as a reminder, local area coordination, the purpose of local area coordination is that all people live in welcoming communities that provide friendship, mutual support, equity and opportunities for everybody. And our team of 23 local area coordinators do that by being present in their communities and through building relationships with people in that community, focusing on their strengths rather than problems and helping them to become more confident and resilient. And most of their time is spent working with individuals, one-on-one and building relationships with them. And we'll talk a little bit more about that as the presentation goes through. And some of their time is spent facilitating some community social capital, such as connecting people who have got a shared interest in setting up a group or an event, but their role in that is not to be the group organizer, but to help to facilitate local people doing that for themselves. The local area coordinators work to increase the capacity and resilience of individuals. And we see that in the examples that we share where people have been in difficult, challenging and often distressing situations, they are, with the help of the LAC working alongside them, able to find that confidence and help to make positive changes without needing to access a formal service. So that's our aim, is to help people stay strong, connected, resilient, help communities to do the same, and to try and avoid them needing access to formal services if they don't need it, and therefore giving space for those people who really do need it. So I'm just going to go through the presentation. Our 2023 impact report is currently in draft format, and we'll be bringing that to scrutiny at a later date. But this presentation has just got a few headlines which I'll work through. And as last year, this year's impact report is going to contain lots of feedback, comments and compliments from the people we work with. So not just the people that we walk alongside, but also our partners and colleagues in the community as well. So these are just a few that you've got on the screen in front of you from some of the people that we've walked alongside. So the first quote at the top, I feel a lot better with someone on my side. Sometimes feel like a ghost in my own home, but you've come and changed that. So as a person who's benefited from the LAC relationship, just to grow in confidence. And often we find that what people need are not necessarily a service or something practical, but just somebody who can walk alongside them, give them the confidence to do things for themselves. And we've got lots of stories and examples of that. The second one in the middle, Joe's helped me find positives in my daily life and helped me realise that I am able to socialise. So getting out of the house, connecting with other people is vital, as we know, to health and well-being. And isolation and loneliness is a real threat to that. And being isolated and lonely can really mean that people have a negative mindset. And having someone alongside you who can focus on the positives that are in your life and some of the opportunities and connecting people to people outside the house is incredibly good for health and well-being. And the last one there, you've restored my faith in humanity and given me a lifeline. So again, facilitating relationship with others, helping people to see the positives in their lives can give people a completely new vision of their life and what they can achieve. And the idea that a local area coordinator can be a lifeline to somebody, again, is something that's reflected in lots of the stories. And I know that a lot of members here will be aware of some of those people that you've worked with and worked with coordinators in your areas. Just moving on, this is just a very straightforward side, just to highlight that last year we produced the LAC guide. Primarily that was for the use of members, elected members, to understand better the LAC role, how it works and how to work with coordinators, but it's also been distributed to other key partners and remains a useful resource, and that's going to continue to be available this current year. This is just a map. Again, it just illustrates our LAC areas. As a reminder, this is on also on our council website. So each area, LAC area, based around population size, and we've expanded over. So this is our 9th year of operation, expanded from 3 areas in 2015. In 2022, we celebrated the first year with full county coverage with 23 coordinators. This year, we in the team we had some long-term illness, and unfortunately, had to one team member had to leave employment due to ill health, but we recruited for that in October and currently again back in full county coverage. And all the details, all the contact numbers and the areas for all the coordinators are on the public-facing council website. With all their contact details, and that's usually the place that's best for people to find to get hold of us. Moving on, this is something we'll highlight in our impact report. We were really pleased to be nominated for the National Safer Communities Awards in November, and then we're delighted that we actually were winners of the category. The category that we were winners of was the Equalities, Inclusion, Cohesion category. And I think that was especially pleasing because although local area coordinators work primarily with individuals and support individuals, I think winning this award recognises also the positive impact that local area coordination has on building safer communities. Again, going back to the purpose in the first slide, the purpose of local area coordination, all about helping to build welcoming, confident, resilient communities. And by working with individuals and working with community members, local area coordination has a really positive impact on that. So that was a really pleasing and a real boost for the team. A team of people who work really hard, so that was a real boost for them. Moving on, I've got a couple of slides just to illustrate some of the stories. So we regularly record the journeys of people we work with, and we share those widely. We share the story, what we describe as stories. So this particular story is Ali's story. We were really fortunate. Our director Dave Howes came and visited with several people in the coordinators last year, and was able to hear their stories. This is one of the people that Dave met with, and I haven't asked him, but boss, I've got your quote in there if that's all right. You can't say no now. But it was a really distressing situation. She was was in a really distressing situation. But Dave's quote afterwards, which I'll just read, is it's entirely plausible that in the absence of the LAC introduction, those individual circumstances would have deteriorated and both their individual and family needs escalated with much poorer outcomes and potentially requiring significant health or social care intervention. So that's an example of exactly what working local area coordination working really well. And that introduction, which actually should have come from a GP, but actually came from the ladies' colleagues, was timely. She was in a really difficult situation, but having a local area coordinator walking alongside her over a long period of time, again, gave her the confidence to deal with some of the issues that were facing her. She suffered a really traumatic bereavement and had children to look after. And as she says on the quote underneath, my negative thoughts, anxieties and grief will have spiraled out of control and that her boys would have had a less well-functioning mother. In fact, if she was here and she's been really open about sharing her story, she's actually now part of our leadership group as a someone with lived experience who can really help us as we move forward with local area coordination. And she's very happy to share her story. And if she were here, she would say that actually she did get to a point where she was considering ending her own life. And actually the impact that would have had on her two boys, not only the emotional impact of that, but actually the impact that it would have had on social services and all the the ripples that would have come for that as well. So that's just one example. That's Ali's story. And in a slightly different situation, Eric found himself in an 83-year-old living up in Penderry, found himself in a really difficult situation when his ability to stay independent was threatened through poor health. And again, a really good example of kind of best practice local area coordination work. The local area coordinator, was able to connect him up with several individuals in the community who were able to offer some of the practical support that he needed. So instead of needing some kind of formal support or being moved out of his home and put in somewhere else where where he probably wouldn't be best placed, but might need to be because of his health, actually the local free, local informal support was able to do some of the practical things for him until he started, his health improved, and he now is able to enjoy a much fuller life as a result. So again, not needing lots of services, but just utilising, facilitating some of that local informal neighbour to neighbour support. And as Councillor Williams said, the impact report will include lots of our qualitative evidence, because that's really the best way that we're able to explain how local area coordination works and the impact that it does have. But we will have some stats in there as well. There's just taken just a few of these. There'll be some more actually in the impact report when we produce the final draft. But this just gives you an idea. So 1,100 new people introduced to coordinators in the last year, and that's in addition to their current workload. So each coordinator is usually working with between 50 and 60 people at any one time, and so these are new introductions to them. Informal contact with over nearly 5,500 residents, and through informal contact we mean just those conversations that people might have in community centres or in the groups they visit. So the coordinators are always in their communities. They regularly attend groups and sessions, or they might be just bump into somebody in a coffee shop or in the library, and that person might have a question. It could be a question about where I get my green bags from, but it could be something more more impactful. It could be something just about how I can access some support, or there might be a short conversation, and it's the kind of contact which doesn't lead then to a long-term introduction, but it can just help people have that information they need. Again, giving them the confidence that they need to move forward. So that's 5,500 residents who have had that kind of informal contact with local area coordinators. And in our database, we record some wellbeing changes, changes in people's stories, and as a coordinator walks alongside them. So we've recorded over 2,500 positive changes reported by people. And then underneath that, the stats you've got are this is just two of many other, and we're reporting all of these in the impact report, but just two examples So 323 people felt more connected and engaged, 278 people feeling more in control of their health and well-being. We've got some other categories that we'll be illustrating in the impact report when it's produced. So just some of the figures, just to give you an idea. But what's really important is that these figures are kept in context with the stories and the context of where they come from, because there's so much more impact that the stories can illustrate than just the figures themselves. There's lots of things that we can add numbers and costs to, but things like increased confidence or feeling less lonely is something that's very difficult to attribute a cost to. But it's something that that is often something that's impacted but very positively. And then our final slide, and I'll be quiet, is just our contact details. So we've got, as I say, we've got a public-facing council website. It's got all our details on it, the map, all the individuals' areas and their contact details. And we don't have, as we've explained before, we don't have a criteria or any particular way of contacting local area coordination. So we don't have a gatekeeper. Anybody can contact a coordinator at any time, and we encourage people to do that. And again, we'll be showing in the impact report the number of people who are able to actually contact coordinators direct. So very often we'll have instructions through GPs or other professionals, but it's good to see that there are people in the communities who are able to contact them themselves.
Yeah.
That's me, Chair. Thank you.
Thank you, John, for the presentation. Lee, do you want to add anything?
If I may, Chair, thank you, and thanks to John and the team for all the work they've done to pull that report together. I think when it does come to the panel, you see it's a larger document than we did last year because we've got so much more great stuff to share. And it's great when we pull these impact reports together. That it's not just an opportunity for us to reflect backwards on the 12 months and the performance that the team have had over the last year, but an opportunity for us to engage with colleagues, stakeholders, members to kind of get some of that feedback on where we're going for the future as well. So really proud of the team, really proud of all the work we're doing, and yeah, hopefully when we bring the report to you all, very happy to follow up and to carry on the conversations with anybody who wants to know more about local area coordination. So thank you, John.
Thank you, Lee. Are there any questions? Councillor Chris Holly.
Thank you very much, Chair. I wrote to Dave, I think it was earlier in the week, with regards to information I'd received that we were going to lose some LACs to grant funding. I wonder if there's any more information that can be given to this panel.
Amy.
Yeah, can I come in on that? Yeah, thank you. Yeah, you're correct. We're out to consultation at the moment with our teams because of the impact of the funding of the team around how that's going to impact. So we've had increased costs and we've had flat grants and a reduction of one of the grants. So whilst you have been hearing about the excellent work the team's doing, we're going to have to look at what this looks like going into the next calendar year. Financial year into 24-25, and whether that's something around the criteria that John's just mentioned, the fact that there is no criteria at the moment, whether that's going to be something in terms of the areas that we focus on, whether that's in terms of the sort of 10 principles around area coordination, and do we need to really focus on some bits? Is it a mixture between how much community work, how much one-to-one work? So these are some of the things we have to look at, but we are going through a staff consultation process at the moment. So obviously I don't want to talk about specifics for staff, but what I will say is we're trying to put in measures in our service around ring fencing opportunities that are coming up. We're looking at other funding streams as well. So we hope to be able to support all the individual impacted staff members, but it does mean it's very likely to look different from April onwards, slightly different.
Given that it's going to have to look, sorry.
Sad, I must be honest. Chris, do you want to come back?
Can I come back?
Yes.
When LECs first come in, the local area coordinators come in, we had some funding from the fire service and a few other, and lots of promises from other people, but I'm not sure if those promises ever came to fruition. So I'm assuming now that the only funding we get is our own and some grant funding from the Welsh Government. Is that correct?
Partly, if that's okay. So you're absolutely right. We have had funding over the years from different partners. Some of it's come, some of it's gone. It's to do with their own funding pressures as well. But it's something the team are looking at and have continued to look at, is those investing partners. So at the moment we have funds from 3 of the registered social landlords. So 3 of our housing partners give us funding towards area coordination. We've got funding via the Health and Social Care Regional Investment Fund, via the West Glamorgan Regional Partnership Fund. We have funding via Housing Support Grant, because a lot of the work the team do is around that, preventing people from becoming homeless and ensuring they maintain their tenancies and or their homes. And then the remainder comes from council funds. So it's around, I think it's less than 40% from council funds and the rest come from grants. So there's no cut to the council funding, but it's just flat, and there is a cut to one of the grants.
Excuse me.
Thank you, Amy. Are there
But-
any other questions? Oh, Chris,
Yeah,
you want to
can
come
I-
back again?
Yeah, can I explore this a little bit further? If the council grant is the council amount is staying the same, yet the other grants are flattening off and due to inflation, the costs, etc. Can we have a breakdown of what those costs would be? Not now, but at some time in the future, because one of the things that you have, the LSEs have been doing a very good job across the patch, and I think everybody would agree. Many people when they started off were very skeptical that they would actually make a difference, but they have made a difference. So it would be interesting to see how the funding is distributed, where we get that funding from, and how it's percentage-wise put out. Obviously, you can't say anything about the personnel matters at the moment because you're up for consultation. But when that's over, can we have a breakdown of the finances, please?
Yeah, absolutely.
Okay, thank you, Amy. Councillor Philpott.
Yeah, thanks. I think just to add on from what Chris was saying, I think what might be helpful, John, you talked a lot about the consequence, the beneficial consequences of the lax. And so there must be a way of measuring the consequential impact and how negative it would have been on various services. So, and that is a huge cost saving. So I think that, if we could have some figures around that, because I'm sure you have been working your way up on that as well, because obviously it's evidence, isn't it? If we've saved people from going to hospital, or we've saved them from being made homeless, or we've saved them from needing more social services, then that is a saving for the whole of many organisations. So I do think that if there is a way of you working out, for example, the lady Ali, that example, I mean, that cost, and I mean, we're talking about people here, but unfortunately, the way the world is, we also have to put it into monetary terms. But I think if you were able to say what that would have cost for those children if they'd gone into care, well, it's not worth thinking about, is it? But I do think that some of the cost analysis about the beneficial savings, I think, would be really helpful. And I'm sure that Chris, that's sort of like, I think, the way you were looking at it as well, wasn't it?
Hayley, would you like to come in?
Yes, please, if I may. There are 2 studies actually being undertaken, and we're waiting on the outcomes of those. But there is that evidence base about the cost impact, as well as obviously the social benefits to local area coordination. And I think it is really important to note that this position that we find ourselves in is in no way a reflection of the work, the exceptional work that the local area coordinating teams are doing in our communities. It is just a challenging financial, pressure that we're in at present as a result of grants and not disinvestment by the local authority.
Thank you, Hayley.
Could I just say, I would hope that nobody misunderstood my question. This is all in its entirety to actually support what we have got going. I mean, I remember John being one of the first LAC going back. I didn't realise it was that long ago now, John. Yeah. So, so I totally support it, but just needing that evidence to support you.
Thank you, Sarah.
No, I was just going to say thank you, Cheryl, and I didn't misunderstand. I just wanted to make sure that, you know, that messaging is put across, and it's put across to the local area coordinator team as well.
Okay. Paxton, you've got a question?
Yes, thank you, Chairman. Obviously, there are numbers that have been mentioned, and reduction in the number of coordinators. There were areas, or there still are areas, where basically the coordinators have only just come into being in fairly recent times. Will we be able to guarantee that we will provide total coverage across the Swansea City Council area?
Don't know if anybody can answer that.
I was just going to say, sorry, I was going to come in and just say, I think that's a part of what's got to be looked at really is, and as I was mentioning, there's a number of different opportunities and choices to be made really now about, sorry, opportunity is probably the wrong word, but you know, the choices to be made about whether it's geography, whether it's criteria, whether it's about spreading the areas much thinner. You know, we know already we've got some quite large geographical areas. You know, it's usually a population of around 10 to 12,000, and I think we're working on around about 15 really in Swansea. So, you know, it's got to be looked at.
Yeah.
So sorry, can't answer it yet.
Thank you, Amy. Any more questions from anybody? Paxton, you've still got your hand up.
Sorry, Chairman, I should have taken it down.
Okie doke. Are
But
there
it'll
any
be-
more questions? Okay, thank you very much for the presentation. It's really interesting. And we keep our fingers crossed that none of us lose lax. Okay, that's the end of our agenda. We go on to item 8, the work programme. Any comments on that? Just to remind you that we've got a joint working party with on the 12th of February regarding social services scrutiny panel and children's services. Yeah. Yes. Yeah. Next meeting of the adult services panel is on the 20th of March at 4 o'clock. Items to be discussed are the update to the West Glamorgan transformation programme, performance monitoring, briefing on annual review of charges for social services, 22-23, and a briefing on llais, which is being arranged. I'd like to bring this meeting to a close and thank you all for attending. Thank you. Can the councillors stay
Yeah, bye.
online, please, for 2 minutes afterwards?